When using the couch, it is important that your patient can easily get onto the couch. If you have an electric or pneumatic couch, you can always raise it or lower it or raise it to whatever position is needed for that patient to get on. If you do not have an electric or pneumatic couch, you can always use a small stool so that they can climb up onto the couch. Always be careful in making sure the client is safe in when getting onto the couch. Guide the patient. Assist the patient to lay down, making sure that the patient is comfortable. It may be necessary to put a small cushion underneath the legs just to give them some support. Again, make sure that the patient is comfortable. Are you comfortable?
Yes.
Also remember that if your patient has a problem with the back, it may not be so easy to treat them in this position. In every single way that you treat your patient, make sure that they are comfortable in the way that you are going to work and understand everything that you are going to do. An explanation is very important. Explaining to the client that I am going to place my hands onto her shoulders. She has complained that she has a problem with her right knee. In this case, I will explain to her that I will move from the shoulders down to the right knee and place my hands in that position. I would also make sure that the client has no glasses or spectacles to remove in case a movement may knock them and they fall to the floor. There is no necessity to remove any clothing at all other than boots or shoes and outdoor weatherwear. The comfort of the patient is paramount, making sure that they are willing to do what they wish to do, but also making sure that you can give the energy healing to them in the proper manner. Some patients may feel more comfortable leaving their shoes on rather than taking them off. It is for you to understand their feelings and the way they want to be treated. I'm now going to move to the end of the couch. As much as it's important to make sure that your patient is comfortable, it's also very important that you are comfortable. Remembering that you may be sitting in this position for up to 30 minutes. Make sure that you are in a comfortable chair and also make sure that the height of the couch compared to the height in which you are sitting is compatible. You don't want to feel uncomfortable and start fighting with yourself because you are in a difficult or awkward position. Again, it is important to place your hands slowly onto the patient's shoulders, gently so as not to disturb them or alarm them. Allow the energy to flow. You must remember at all times you are actually doing nothing. You're merely a channel or connection for the energy. You have no power and no control in how the energy is dispersed. It is important to remember that you are there as a tool and nothing more. When you feel comfortable that you have finished working with the shoulders, which allows the energy to flow completely through the body. Also remember that you can treat the patient in its wholeness just from the shoulders. It is not necessary to go to other parts of the body. But bearing in mind, this patient has said that she is not comfortable with the pain she has in her right knee. Therefore, by placing your hands on the knee, the patient feels that you have completed the healing task. I'm now going to remove my hands away from the patient slowly and move to the knee. Please remember, when moving from the shoulders to other parts of the body, that your patient will be in a very relaxed position. In some cases, they may even have fallen asleep. so it is important not to startle them. I place my hand gently under the knee and then over the top. That's all that is necessary. Leaving your hand there until you feel comfortable that the energy has completed its work. This may be just 1 or 2 minutes, or it may be 10 or more. It is up to you with your own discretion in the way that you work that you feel most comfortable. Make sure that all times when you're treating the patient that you are keeping an eye on them, that they are okay. Remove your hands gently from the patient's knee. Return to the shoulders and place your hands gently upon them. Again, when you have completed, lift them gently away. Either press gently to the sides or just to one side, indicating to the patient that you have finished. It is very important at this stage, before the patient sits up on the couch, to make sure that the patient is comfortable. Assist the patient to sit up in that position, asking the patient, do you feel okay?
Yes.
Do you feel dizzy?
No.
Then ask the patient to swing their legs round, making sure that they are still comfortable. If the patient feels dizzy, place your hands onto their head in a gentle way. Hold them there for just a few moments. Remove them and ask the patient, do you still feel dizzy?
No.
If the patient said that she still felt dizzy, then it would be necessary to return your hands to the same position, holding them there just a little longer, and then remove them again. It is very important and your responsibility to make sure that your patient is in a stable and happy situation. Remember that your patient, if had fallen off of the couch or feels dizzy when they leave your premises, could sue you. Although your insurance is covered for $2 million, it is important to remember that your patient is in a good and healthy position when they leave you.